Hello everybody. Today we'll discuss a very important topic in ICU, that is paracetamol toxicity. It's days not far when we might even have a subcutaneous patch available. So toxicokinetics, what happens when we consume paracetamol? Hepatic metabolism, of course. So it undergoes two types of metabolism. One is glucuronidation and sulfuration. So 90% of the metabolism occurs through glucuronidation and sulfuration, resulting in a formation of glucuronidate and sulfate metabolite, which are most non-toxic metabolite and are usually excreted by the urine. But 10% of the paracetamol is converted into a toxic compound called NAPK, that is N-acetyl paraquinine amine. This is the culprit here. So this NAPK is only the 10% which is formed, and usually what happens is, physiological states, this NAPK gets metabolized by antioxidants like glutathione in the body. But during abuse, when the NAPK production increases and the glutathione stores reduces, that is where we have the problems of toxicity. So in overdose, the increased formation of NAPK depletes the glutathione, and once glutathione is depleted more than 2/3, remember it is almost when the glutathione is depleted to 70% of its normal value, the NAPK goes and binds through the lipid bicellular layer. It goes and binds to the lipid bicellular layer in the hepatocytes. And this binding of the NAPK to the lipid bicellular layer in the hepatocytes results in the death of the cell as well as hepatocyte necrosis. It results in loss of activity of critical proteins and eventually hepatic cell death. So what is the toxic dose? As per NPIS, that is National Poison Information Service, the toxic dose is defined as in the form of acute overdose, staggered overdose and therapeutic excess. These three definitions are very important when it comes to theoretical point of view. So acute overdose is taking excessive amount of paracetamol ingested over a period of less than 1 hour. Remember this word, excessive dose in less than 1 hour, especially in the context of self-harm. And what is the dosage? We'll know it later. Staggered dose is excessive amounts ingested for longer than 1 hour in the context of self-harm. But what is the therapeutic excess? Therapeutic excess is excess paracetamol taken with intent to treat pain or fever without an intent for self-harm. That the dose of that paracetamol ingested is at a dose greater than the licensed daily dose or more than or equal to 75 mg per kg per 24 hours. So your licensed dose to give paracetamol is 75 mg per kg per 24 hours, that is in a day, this which can approximate to almost 4 grams in a day. Remember, that is the licensed dose, not the toxic dose. And beyond the licensed dose, we slowly approach towards the toxic dose. This can involve use of excessive dose of the same paracetamol product or more than one paracetamol containing product. Like we know, paracetamol comes in combination with diphenhydramine in the form of Cinaricet. Paracetamol comes in combination of tramadol with paracetamol-tramadol combination. So it's not just the generic paracetamol or APAP which you give. It is in combination with your antihistamines or your non-opioid analgesics. When you give them, your licensed dose is limited to 75 mg per kg for 24 hours. So the recommended therapeutic dose for paracetamol in adults in 24 hours is 4 grams. But in patients, for caution, in patients weighing less than 50 kgs, there is definitely an increased risk of toxicity and overdose even if you give this 4 grams. That is, in a patient who is weighing less than 50 kgs, definitely we have to be in caution and be very careful when we even touch the 4 gram border. So what are the signs and symptoms of paracetamol toxicity? Nausea, vomiting, altered sensorium, abdominal pain, especially the right hypochondrium pain, then your decreased sensation, rearranged LFT, coagulopathy, etc.